Hello everyone, welcome back for another webinar hosted by Dr. Kearney's team of volunteers. Our names are Cushy and Winnie, and we're so excited to teach you guys all about nicotine replacement therapy today. We hope that you're taking care of yourselves and you're staying safe. I would like to apologize in advance for my coughing and raspy voice throughout the webinar today. I'm kind of recovering from being sick. But yeah, let's get started. So with the new year approaching, we thought that this is a really great opportunity and a great time for us to educate everyone watching at home and ourselves about nicotine replacement therapy. And this is a great time because we can meet our New Year's resolutions, one of which might be to quit smoking. So we really hope that you learned something new today, and let's get started. So what we'll be taking you through today is what is NRT, the different types of NRT that are available. We'll look at some NRT myths, and then we'll look at who should not use NRT and what risks are involved, how to safely use NRT, and then we're going to compare vaping and NRT, and then we'll take a look at some resources for you guys. So what is NRT? So nicotine replacement therapy is the most commonly used family of quit smoking medications. NRT reduces withdrawal feelings by giving you a small controlled amount of nicotine in the form of gum, patches, sprays, inhalers, or lozenges, but none of the other dangerous chemicals that are found in cigarettes. NRT can help you relieve some of the physical withdrawal symptoms so that you can focus on the psychological or the emotional aspects of quitting. This small amount of nicotine helps satisfy your craving for nicotine, and it reduces your urge to smoke. Many studies have actually shown that using NRT can nearly double the chances of quitting smoking. People who smoke and are significantly dependent on nicotine should consider nicotine replacement therapy to help them quit. Signs of severe nicotine dependence include smoking more than 1 pack a day, smoking within 5 minutes of waking up, smoking even while sick, waking up at night to smoke, smoking to ease symptoms of withdrawal. These are all signs of severe nicotine dependence. But first, let's talk about why you should consider smoking to begin with. So quitting smoking is one of the most important actions that people can take to improve their health. This is true regardless of your age or how long they've been smoking. Quitting smoking improves your health status and enhances your quality of life. It also reduces the financial burden that smoking places on people who smoke, the healthcare systems, and society. Quitting smoking also reduces your risks for many adverse health effects, including poor reproductive health outcomes, cardiovascular diseases, chronic obstructive pulmonary disease, and cancer. Quitting smoking reduces your risk of coronary heart disease, with risk falling sharply 1 to 2 years after cessation, and then declining more slowly over the longer term. It also leads to rapid improvement in high-density lipoprotein cholesterol levels, so your HDL-C levels. And it also reduces the development of subclinical atherosclerosis and slows its progression over time. In addition, quitting smoking is the single best way to protect family members, co-workers, friends, and others from the health risks associated with breathing secondhand smoke. And lastly, quitting smoking reduces the risk of premature death and can add as much as 10 years to life expectancy. It reduces the risk of disease and death from stroke, with risk approaching that of never smokers after cessation. It may also reduce the risk of atrial fibrillation, sudden cardiac death, heart failure, and peripheral arterial disease. People already diagnosed with coronary heart disease also benefit from quitting smoking. For example, if you quit smoking after a diagnosis of coronary heart disease, it reduces your risk of premature death, it reduces your risk of death from heart disease, and it reduces the risk of having a first heart attack or another heart attack. So over time, people who quit smoking see many benefits to their health. After you smoke your last cigarette, your body begins a series of positive changes that continue for years. For example, within just the first 20 minutes after you stop smoking, your blood pressure and pulse return to normal, and by 24 hours, your risk of heart attacks starts to drop. After 2 weeks of not smoking, your circulation increases and the airways in your lungs relax. After 10 years of not smoking, your risk of dying from lung cancer is much lower. So you can see that not only does your body experience immediate positive changes, but also long-term health benefits after you quit smoking. And this is your sign to start your journey to healing.
Alrighty, perfect. So now that we know a little bit about precisely why we should quit and what the benefits are, let's dive into nicotine replacement therapy specifically. So as Kushi mentioned earlier, nicotine is the addictive component of cigarettes, and it's what gives you that high, but it's actually the other 7,000 chemicals in burning cigarettes, like carbon monoxide, arsenic, nickel, vinyl chloride, all these other chemicals that cause cancer and those other diseases. Now, taking nicotine on its own can help ease those cigarette cravings and help you quit, but it doesn't result in the harmful effects of smoking. So what this process looks like is that over time, you would take nicotine replacement therapy in the form of patches, gum, lozenges, etc., whatever you think is right for you and your lifestyle, as well as the amount of nicotine that you usually smoke. And then over time, you generally decrease that dose, and then eventually within 2 to 3 months, you gradually stop taking nicotine replacement therapy, and so then you're off, you're done smoking as well as nicotine replacement therapy as well. So something to keep in mind is that taking nicotine replacement therapy does not entirely get rid of withdrawal symptoms. Some individuals come in expecting nicotine replacement therapy to be like a cure-all for those symptoms. And it really isn't. So we just want to explain precisely why to start off. So one of the differences is that when you're inhaling cigarette smoke, nicotine gets absorbed and transported to your brain a lot faster, so essentially within seconds, versus if we're looking at nicotine replacement therapy, that delivery system requires a bit more time. So that means it may take a few minutes for things like sprays and oral products like gum, or even hours for when you're using a patch because it's absorbed through skin. So as a result, the high that you experience doesn't feel as satisfying. But the most important thing to keep in mind is that nicotine replacement therapy does help take the edge off, and it reduces those withdrawal symptoms. So that can be very beneficial. Furthermore, it also helps ensure that smoking feels less pleasurable. So even if you are still smoking a few cigarettes in between, having a patch on or having gum, like, it's still very helpful for helping you quit. Now, there are a lot of different forms of nicotine replacement therapy that are available out there, and this is just a really quick summary slide to show you the different types that are available as well as their differences. So we have patch, gum, lozenge, nasal spray, or mouth spray, as well as an inhaler, and you see an illustration at the bottom of this page just illustrating what they look like. Just to highlight, there is a difference between fast or short acting versus slow and long acting types of nicotine replacement therapy. So slow and long acting types, it's typically referring to a patch. So it is, although it takes a bit longer for the effects to kind of take hold, like, because it's a result of that difference in delivery system that we mentioned earlier, the nicotine that comes from the patch will essentially exert its effects over your body for a longer period of time. So over the day, you'll get like a constant level of nicotine in your blood, kind of, in a way. Whereas on the other hand, those fast, short-acting, also known as rapid-acting products, those are better for managing stronger cravings. So that might be when you encounter a trigger or when you anticipate a trigger, such as taking your morning coffee, or when you go on a break from work and you're with your coworkers who also smoke. You can kind of anticipate, or you can feel those cravings coming on stronger than before. This is when you might pop, a piece of gum or pull out the spray. So you can use them more or less depending on your needs, so it's as needed. Something to highlight as well is that a lot of people commonly use a patch as well as one of those rapid acting products on top of it, and this is something that's called combination therapy. We'll dive into combination therapy a little bit more in this presentation later on, but just know that it can be beneficial to pair something that's slow but long acting with something that's more rapid acting. So diving into patches to begin with, patches have the benefit of providing a slow, sustained release of nicotine, and this helps manage general cravings. Something that a lot of people enjoy about the patch is that it is incredibly convenient. You essentially slap it on in the morning, you put it on below your neck but above the waist, so people typically put it on their arm or along the side of their chest, something like that. and it just provides you with a nice constant level of nicotine throughout the day. Some individuals do experience some minor side effects with use, and so we wanted to touch upon some of those side effects as well as how you can manage them and continue using the patch, because it is still a great support for helping you stop smoking. So one of them would be skin irritation, and some solutions include changing the location of the patch daily. So if you put it on the arm one day, move it, up or down a couple of inches the next day, or switch to the chest, something like that. Something else is just trying a different brand, because it might just be the adhesive, I guess, that is causing the irritation. And so you can change the brand, and that sometimes has resolved the itchiness for some individuals. A second most common side effect for patches is sleep disturbances, in which case it's because the high level of nicotine sometimes results in a bit of insomnia. So some suggestions for resolving this is, number one, first wait about 3 to 4 days to see if those symptoms disappear, because there can be an adjustment period for your body. So after you pass those 4 days, it can become a lot easier to fall asleep, even though you're wearing a 24-hour patch. But if you're not comfortable with wearing a 24-hour patch, it can be handy to switch from that 24-hour patch to a 16-hour one, which is available. So if you're having trouble finding those, feel free to talk to your healthcare provider or pharmacist in order to decrease the time period that those patches act on. Also, consider taking the patch off before going to bed. Just keep in mind that this might mean that your morning withdrawal symptoms will be stronger though, but if this is something you're comfortable with, you can take it off an hour or two before you go to bed so that the level of nicotine wears off a bit, and then you can sleep a bit better. And then lastly, you can consider trying a lower dose. So if you're taking a 21 milligram patch, for example, it may be, the level may be a bit too high for your body, and so you can decrease to 14, or if you're on 14, you can decrease to 7. But you do want to ensure that the dose you're taking is still high enough to keep your withdrawal symptoms at bay. So it's okay to just test things out until you find what works best for you, but just keep trying, and eventually something will click. Now, next, I'm going to move on to gum. Something I want to highlight is that nicotine gum is not taken like traditional gum where you just throw it in your mouth and you chew it a bit. With nicotine gum, what is recommended is the chew and park method. So you chew the gum until you taste the nicotine, or rather you feel like a tingle, which indicates, that the nicotine is out of the gum and going into your mouth. This is when you would kind of park the gum between your cheek and the gums in your mouth. So just leave it there, stick it there, and go about with your day. And that'll allow maximal absorption of nicotine into your body. And then you kind of repeat this process until the tingle is gone, which overall you can take the gum for about 30 minutes. Overall, you can take about 1 to 2 pieces an hour to start, or you can use it as needed. So it's up to you however often you want to take the gum, but just use it when you feel that, you feel triggered or you have stronger withdrawal symptoms. And also keep in mind that ideally you do not want to eat or drink anything 15 minutes before using the gum within those 15 minutes, particularly acidic drinks like pop, coffee, or beer, because it does interfere with nicotine absorption. All right, next, moving on to lozenges and sublingual tablets, sometimes marketed as microtab in the case of certain unnamed nicotine replacement therapy brands. So this is a nice alternative if you're not able to chew gum. So that might be because, you have dental work, you have braces or dentures or something like that, or you're just in a professional environment, like you're at work and, chewing gum is frowned upon. For the lozenge, you essentially just suck on it, and occasionally you move it from side to side and try not to swallow too much, because majority of the absorption is happening, in your cheeks, under your tongue. And you don't want to keep swallowing the nicotine because that will not allow for maximal absorption. And the same thing with the sublingual tablet, you place it under your tongue, and you would take about 1 every 1 to 2 hours. Now moving on to, lastly, inhalers and sprays. So we've got quite the combination here. To start off, inhalers. Inhalers have the benefit of kind of mimicking a cigarette. So you can kind of see based on the picture, it's kind of like in a tube shape, has a little puckered end, which is the mouthpiece. And so you would bring it to your mouth so you bring your hand up to your mouth to inhale and essentially treat it like a cigarette and breathe it in. The nicotine is, contrary to the name inhaler, it's not actually absorbed in your lungs. It is absorbed in your mouth, esophagus, and stomach. So as a result, the absorption rate is still slower, like gum. It's not the fast method that you get through cigarette smoking, but it does have that nice familiar behavioral comfort to it. Next, we have mouth spray, also known as quick mist for some brands. And you would aim it at the side of your mouth or under the tongue. Try not to swallow for a few seconds to allow for that absorption. And you would take 1 to 4 sprays an hour or as needed. Yeah. And then lastly, the nasal spray. So this nasal spray actually has an advantage in that it's actually faster acting. So it's a good option if you require a delivery system that provides nicotine into your bloodstream faster. So you would spray it up your nose, 1 squirt for each nostril. You start with 2 doses an hour, meaning like 4 squirts in total, I suppose. So 2 for each nostril. And then you want to use it maximally, like only 40 sprays per day. And of course, for all of these methods, you adjust it as necessary. Please don't feel any need to hit that maximum or anything. Just do what you need to do in order to keep your symptoms at bay. Just want to touch upon the inhaler again. You'll notice that there's that container in the image included. What it shows is like these little nicotine canisters. So you would use, or the cartridges, I guess. So you would use however number that you require throughout the day. Typically, we'd say minimum 4 to 20 a day as needed. And so you would kind of keep reloading the canister, and instructions will be provided in the product when you purchase it. Now, just to quickly touch upon combination therapy. I did mention it earlier when we were on that slide with the table on it, but to dive a bit deeper into it, combination therapy is, again, using a long-acting patch along with a rapid-acting nicotine replacement therapy method, so gum, lozenge, spray, something of that sort. And the aim is that you would use the patch for slow nicotine delivery to manage withdrawal symptoms overall, and then you use that rapid-acting NRT as an emergency method, sort of. So kind of like a rescue inhaler in a way, if you have asthma or something like that. It's just an analogy. But you use it as needed when you experience more intense cravings. You need that faster relief. So it's very convenient. And it actually shows, research has shown that using combination therapy, so patch plus spray or plus gum, something like that, it increases your chances of success by 34 to 54%. So if you have the financial means, or if you're able to access resources for free nicotine replacement therapy, more on that later actually, because we'll be talking about it, feel free to consider truly reaching out and giving it a shot, because your chances of successfully stopping quitting are a bit higher if you use a combination. If you are not sure what dose of nicotine replacement therapy you should be on, we just want to provide a quick guideline over here. Don't worry, not going to read it all, but these are just some examples. So always keep in mind that the dose that, there's no specific amount that you need to be taking. It all depends on your personal needs. So feel free to adjust. But some examples include, if you're smoking less than 10 cigarettes a day, it might be nice for you to start with a 14 milligram patch for a couple of weeks, and then decrease it down to 7 milligram and so on. So it provides a nice guideline on this table. And then again, with the combination therapy benefit, with that patch, you can add on an additional gum or inhaler or etc. Just want to touch upon how, even though the patch is available in 7, 14, and 21 milligram doses, if you are smoking like over 2 packs a day, then chances are the 21 milligram is not going to cut it for you. In which case you can double up on the patches and wear more than one. Of course, please do speak to your healthcare provider to ensure that it would be a good fit for you. We are not physicians and we do not want to recommend things that may potentially be harmful for you, but just wanted to share that this is an option for a lot of individuals out there who would be suffering from, stronger withdrawal symptoms if the amount of nicotine provided by the patch is not sufficient. Okay, but always adjust the dose based on need. If you feel like you have strong withdrawal symptoms, then you can increase the amount or the dose that you're taking. And if you feel that you have side effects of too much nicotine, like fast heart rate, nausea, that sort of thing, then feel free to decrease the dose. So adjust based on your needs. Okay, and want to quickly touch upon this. Please remember that nicotine replacement therapy should be used for at least 2 months. So 2 to 3 months is ideal. Most NRT users do stop it prematurely because they feel like their withdrawal symptoms and cravings are managed or gone, and then they stop. But the thing is, those symptoms sometimes come back, or those individuals get triggered by something, which puts those individuals at a greater probability of relapse. So it is best to use NRT for 3 months, 2 months at the very least, and do talk to your doctor if you think you require extended use past 3 months or 12 weeks, because that's all right, but just discuss. And always continue using nicotine replacement therapy if you think you may relapse without it. Continuing NRT in the long run is still a lot healthier for you than smoking, so just something to keep in mind. And lastly, before I switch things over to Cushy again, just want to touch upon how to choose the right NRT for you. So these are some things that you ought to consider, and feel free to whip out a pen and paper just to keep track of what might suit you best. So some things to consider include, how much do you smoke each day? Because heavier smokers would typically benefit from the combination therapy, so that would be patch as well as an acute method. Also consider what would best suit your lifestyle. So if you can't chew gum at work, then other methods may be better for you. Or if you're usually on the go and you don't want something that you have to take regularly every couple of hours or something like that, then patches can be very convenient because you just put it on in the morning. Also consider how quickly you want symptom relief. Consider things like how nasal sprays are faster acting, or you would benefit from a rapid acting method like gum or a lozenge or something like that if you want greater relief. Consider what your behavioral habits are. So would you benefit from a method that is administered mouth to hand, like a spray and inhaler, where you're bringing something up and kind of mimicking the smoking action, which can be something that some individuals prefer. They miss the habit of smoking sometimes. Consider if you'd like to quit cold turkey or gradually. So if you're quitting cold turkey, meaning you're stopping smoking entirely all at once on that one day, that means that you'll be experiencing stronger withdrawal symptoms initially, and so that means more nicotine replacement therapy may be needed. So a higher dose, particularly a patch, and you may need to use more methods. Consider also, do you require sugar-free options? Because that's something to consider if you do have diabetes, as well as whether or not you have dentures and dental work, because that means something like gum is not a good choice for you because they can get stuck. All right.
Okay, so now that we know a little bit more about what nicotine replacement therapy is and the different nicotine replacement therapy products that are out there that are available for you to use, let's address some NRT myths that you may have heard so that you're not misinformed. So let's start off by addressing smoking while wearing a nicotine patch is dangerous. So this is false. You don't need to take the patch off if you slip up and have a cigarette. It's best to leave it on. So slip-ups, meaning a puff or a cigarette during a quit attempt, slip-ups are very common. It doesn't mean that you should stop trying to quit, but it might be a sign that you aren't using enough nicotine replacement therapy. So for example, you might need to increase how often you're using the faster acting types of NRT. It's best to speak to your doctor or pharmacist, though, to help you work out what dose and how often you should be using your NRT, so that you can prevent any slip-ups in the future. Next, I can get addicted to NRT. So again, this is false. Most people stop using NRT when they feel like they no longer need it. Like Winnie mentioned before, the amount of nicotine in NRT is actually lower compared to a cigarette, and it also takes longer for nicotine to get to the brain to give you that nicotine hit. So this means that it's much easier to stop using NRT than it is to stop smoking. So some people may continue to use NRT for longer than recommended, possibly because they're addicted to nicotine, but it's still safer than continuing to use tobacco. Next, nicotine replacement therapy will interfere with my medications. So this is actually false. NRT is safe to use with all medications, but smoking, on the other hand, can actually interfere with the effectiveness of many medications. So of course, NRT is a better option compared to smoking. Next, I can't wear the NRT patch during the night. So again, this is also false. It is safe to wear the patch both day and night, and studies have shown that individuals who wear the patch 24 hours a day typically actually have fewer withdrawal symptoms, especially early morning withdrawal. So they have less withdrawal symptoms in comparison to those who don't. So, however, if the patch begins to cause you sleep disturbance or you have odd dreams, like when you mentioned, it can be removed before bedtime and then reapplied once you wake up. Next, the e-cigarette has been shown to be safe and can help people quit. So this is partially false. We simply don't know enough about the e-cigarette yet. There haven't been enough unbiased, reliable scientific research studies done to date that have demonstrated that it's safe and that it can help people quit. Medical professionals at the moment currently only recommend evidence-based treatments to help smokers quit, and that includes NRT. But we'll touch a little bit more on this a little bit later in the webinar. Lastly, some people should not use NRT. So this is absolutely true. NRT has been available for more than 30 years. A great deal of research has been done on NRT, but the research shows that NRT is safe and effective for almost all adults for quitting smoking, except some. So for most people, there is no need to talk to a doctor or healthcare provider before using NRT, but for others, there is a need for talking to the medical professional beforehand, which we'll dive into now. So who should not be using NRT? Building off of that last myth that I just mentioned, some people should not be using NRT. The US Agency for Healthcare Research and Quality states that NRT is safe for all adults who want to quit smoking, except for pregnant women, teens, and people with serious health issues. So serious health issues can include lung diseases or heart problems. So people with these problems might still be able to use NRT, but you should talk to your doctor first. Even if you don't fit one of these categories, it's best to discuss NRT use with your healthcare provider before starting it. You may have medical problems that should be considered. When deciding whether to use NRT, the benefits of quitting tobacco must also outweigh the potential health risks of NRT for each person. People who are still smoking or are using any other form of tobacco should also try to avoid using NRT. The companies that make these NRT products warn that you shouldn't use them if you're still using tobacco, and the FDA has also not approved them to be used in this way. So again, get advice from your healthcare provider if you want to use NRT while continuing to smoke or chew. Also, NRT has not been proven to help people who smoke fewer than 10 cigarettes a day, but many tobacco treatment centers do use NRT for light smokers. So again, talk with your healthcare provider about a lower dose of NRT if you smoke less than 10 cigarettes a day, but you feel like you need a nicotine replacement.
All right, so moving on, we just want to touch a little bit about the risks of nicotine because with taking any kind of chemical, I guess, it does come with its own risks. So we want to touch upon it a little bit to help assuage your fears. So to start off, nicotine is actually toxic when over 50 milligrams is taken. Generally, I guess it depends on your body size and things like that. But the most important takeaway is that you should always remember to follow the appropriate dose for yourself based on how much you're smoking, as well as what your healthcare provider has told you. But the good news is that there is no evidence of NRT being dangerous so long as you continue following that appropriate dose. Also, do keep in mind that you should not be heating the skin near nicotine patches because it does cause more nicotine to be absorbed due to increased blood supply in that area. Did want to touch upon another potential risk. There is currently a limited amount of research that shows that nicotine may play a small role in causing cancer, although we do want to emphasize that more research is needed. If this does concern you, please do keep in mind that nicotine replacement therapy will always be healthier than smoking, so NRT is always going to be the lesser of two evils, and so it's just always healthier for yourself to start nicotine replacement therapy rather than continuing to smoke. Other risks include the side effects that we previously touched upon, including things like skin irritation from patches, as well as sleep problems like mentioned before, as well as things like dizziness, faster heart rate, headache, and nausea. But just to note that some of these symptoms, such as faster heart rate and headache, these are often also smoking withdrawal symptoms, but some individuals associate them with the nicotine instead. So just a reminder that it could just be that you're craving a smoke, and that's why you're experiencing some of these symptoms, although it can be pretty hard to distinguish at times. Yeah, keep in mind that a lot of individuals do not experience these symptoms, But if you do, then it is important to talk to your healthcare provider to try to find a potential solution. So in terms of reducing these side effects, some recommended courses of action include reducing the dose of nicotine replacement therapy, as well as trying a different brand. If, for example, you're using a patch that feels irritating, you can switch to a 16-hour patch instead of a 24-hour patch in order to reduce the amount of nicotine in your system when you're sleeping. You can see if there's a different type of NRT that better suits your needs. So if you're taking a gum and you find that it's not quite working for you, you can switch to a nasal spray instead, or something else. And again, you can continue taking the NRT for a few days and then see if it works better for you. Sometimes our bodies just adjust and it works out better in the future. But just keep trying new things and then giving things a shot, and eventually you'll eventually find a routine or a routine that fits you and your lifestyle a lot better.
Yeah, so keeping those risks in mind, let's kind of talk about what precautions you should take with NRT and how to safely use it. So NRT products are supposed to roughly match the amount of nicotine that you typically took in through tobacco, and that's really important to remember. It's also important to note that certain types of NRT may help you more than others. If you look at the way that tobacco is used, nicotine gum and lozenges are most like using smokeless tobacco. They also let you control your dose to help keep nicotine cravings down. So to avoid withdrawal symptoms, you want to, again, aim for a nicotine dose that's fairly close to what you got from your tobacco use. Also, nicotine replacement helps prevent weight gain while you're using it. You may still gain weight when you stop on nicotine use, however. Also, it's really important that the dose of nicotine is slowly decreased over time as you regularly use it. You want to slowly lean off of that NRT and become less dependent, which is why you want to decrease that dose with time progression. Nicotine patches are okay for use by most people with stable heart or blood circulation problems, but the unhealthy cholesterol levels, meaning the lower HDL levels that are caused by smoking, those don't get better until the nicotine patch is completely stopped. So that's, again, something to keep in mind. Also, this is really important that you keep all nicotine products away from children. Nicotine is harmful in high doses, so you don't want your kids to get their hands on this. And lastly, you want to trying to quit smoking may affect your mood. So you're at an increased risk for depression no matter what method that you're using to quit smoking, and this can happen even if you have a history of depression or you don't, or mental illness or any of that history. Even if you don't have it, it's possible. So you want to talk to your healthcare provider if you start feeling unusually sad when you're trying to quit or even after quitting. So we've been talking a lot about NRT, but some of you guys might be wondering, what about vaping? So the habit of smoking can be one of the hardest things to change. That's why some people prefer vaping or e-cigarettes to quit. And these e-cigarettes are becoming a preferred alternative for nicotine delivery among many smokers because of their realistic look and feel and taste compared to traditional cigarettes. With vaping, a nicotine-containing or nicotine-free aerosol, which is the technical term for which is vapor, that vapor is produced when e-liquid is exposed to a heating element and inhaled. This nicotine is then absorbed into the lungs, and the aerosol is exhaled. This process has both been praised and criticized for its similar feel and visual likeness to smoking. The FDA has actually reported that e-cigarette cartridges and solutions contain potentially harmful components, and they recommend that the sale of e-cigarettes should be prohibited or regulated as dangerous nicotine delivery systems. The current evidence suggests that electronic cigarettes are an effective smoking cessation tool, but more research is needed to confirm its long-term effectiveness and safety. But something to keep in mind is that vaping is about more than nicotine. When you've been smoking for a long time, it becomes part of your life. Vaping lets you keep your routine and the nicotine without as many harmful toxins that come from burning tobacco. You should aim to stop smoking completely, however, rather than smoke and vape, as even one cigarette a day can cause damage. One of the limitations of current smoking cessation treatments is that none adequately address the sensory and the behavioral aspects of smoking that smokers miss when they stop smoking. For example, holding a cigarette or taking a puff and just the enjoyment of smoking. But electronic cigarettes may offer a way to overcome this limitation. There are a few published studies about its effectiveness, but not many because as vaping is still relatively new, there aren't a lot of trials over long periods of time. A recent study actually shows that vaping is almost twice as effective as NRTs in helping smokers quit. A clinical trial in the UK compared 886 people who were trying nicotine replacement therapy versus vaping. They were given 3 months of product and 4 weeks of support from a quit coach, and then they were left to keep going on their own. A year later, the researchers found that 10% of the NRT group were still non-smokers, and 18% of the vaping group were still non-smokers. That's almost twice as effective. But among participants with 1-year abstinence, 80% of those who quit using e-cigarettes were still vaping, while only 9% of NRT users stayed on the NRT products. So if you're vaping, you should have a long-term goal to quit vaping too. Don't rush though, stay on the vape for as long as you need to, and when you feel ready that you won't go back to smoking, you can taper off the vaping in order to achieve your next goal of being completely smoke-free and vape-free by reducing the strength of your nicotine and changing your habits.
All right, and now lastly, before we end off this webinar, we just want to quickly touch upon some ways to access free nicotine replacement therapy, as well as counseling and other resources on your journey to quit. So one of the first resources we want to recommend, particularly because most of our audience is based in Hamilton, is Hamilton Quit Smoking Network, which you can go to at the website www.hamiltonquitsmoking.com. And this is just a screenshot that we took from their website, but just illustrates how diverse their supports are. They do help you find out if your family physician's office provides support. More on the next slide, so we'll get to that. But if you are of Indigenous background, or you speak French, or you have a mental health condition, if you are pregnant, if you are a youth, a young adult between ages 18 and 29, just feel free to pause this video at this time and see if any of these categories apply to you, because there are a lot of resources and supports for you where they refer you to a specific program or support that's available. I could touch upon each of these individually perhaps, but we figured it'd take too long, so we're just going to direct you to this website instead. If you are having trouble registering for any of these programs or accessing support or information in general, please do feel free to book an appointment for smoking cessation with our cardiology clinic, and one of our volunteers will very gladly help you go through the process. This applies as well if you know someone who is looking to quit smoking but they lack internet access. One of our volunteers would be happy to connect and help you handle the online aspect. Now, on the previous slide, we did mention how the Hamilton Quit Smoking Network has a nice link to talk about how you can access NRT through your family physician. So first step is to go onto that website and then go into Physicians with NRT program underneath the site to see if your physician offers NRT. There will essentially be a drop-down menu for you to see if you go into the drop-down menu, you see if your family physician's name is listed, and then once you click on them, it'll either show a blue light showing that they do provide NRT, or it'll be red and say unfortunately they do not. But it's just good to check to see if they have support. Do want to emphasize, you can feel free to just call and talk to your family physician to see if they have other resources available. They may be able to refer you over to a local program perhaps, but just feel free to open up avenues of discussion because your doctor is a great support. Something else that can be a fantastic resource is the Stop on the Net program, which is short for Smoking Treatment for Ontario Patients on the Net program, and it's a collaboration between the Ontario Ministry of Health and the Centre for Addiction and Mental Health, so CAMH. What it is an online program that provides free counseling as well as nicotine replacement therapy for up to 1 month. So if you just go onto the website, nicotinedependenceclinic.com/English/stop/home, you can click the Enroll Here button, as shown on the little computer diagram on the left side, to see if you are eligible and to register for the program. Another good resource, particularly if you do not have internet access, is the Nicotine Dependence Clinic, also run by CAMH. So what it is it is a service that provides assessment, medical consultation, group counseling, and medications, including potentially nicotine replacement therapy. Not quite a medication, but I do know that they do provide some support for accessing it in order to help individuals quit smoking. So another added privilege is that you can actually self-refer. They do accept doctor referrals and such, but it's also very convenient because you can call the number listed here, 416-535-8501, then press option 2 in order to self-refer and talk to someone in order to self-register. Next is the Caring for My COPD program run at Compass Health. So it is a program that is mainly focused on managing COPD. So it's not fully for smoking cessation, but just want to touch upon it because they do provide some phone and video smoking cessation counseling. So it's a good resource if you like someone to hold you accountable, to have a bit of support from an external individual, that sort of thing. So to dive deeper into it, it is a 10-week program. Typically there are 2 video or phone calls a week that include some exercise programming as well as education. You do come in once in person to the center at the start for an exercise test, and then from then on, everything else continues through either phone or video call. And it does require a referral, but this is a great resource for if you have been diagnosed with COPD and you notice that your breathing is worsening. So even if you're not, looking to quit smoking, it's just a good resource for improving your health. Next, there is the Smokers Helpline. So great resource because you can call the phone number listed, 1-877-513-5333, and they'll help you with things like managing cravings, talking to you about quit aids such as NRT, helping you find local support, and they'll follow up if you require, someone to hold you accountable or to find, a quit buddy or something like that. If text message is more of your style, then you can feel free to text I quit to the number 12356. Smokers Helpline does also have a website, so if you go to smokershelpline.ca, they also provide a lot of great information about the benefits of quitting smoking. That includes financial benefits. There's a little calculator there to see how much money you'd be saving if you quit today, health benefits, as well as the impact on loved ones in your life and that sort of thing. You can also register for their online program, which allows you to have like a nice dashboard to keep track of your next steps, to hold you accountable, as well as a personalized quit program that you can go through to see, to help you keep track of your journey and see what next steps may be, and access community forums if you're someone that benefits from a bit of social interaction and support from others who are going through, similar challenges that you are. And lastly, you can visit something called Quit Map on their website. If you just go onto the main Smokers Helpline website and then click on the little tab at the top that says how we can help you, something like that, there'll be a link to something called Quit Map where you can search up local support near you by typing in your postal code, as well as any keywords that may apply to you, such as mental health or indigenous or something like that, to see if they can list any programs. So they'll pop out a whole list of supports that are geographically near you, which is a great resource. And lastly, Lung Health Foundation is a great resource as well because they do provide a nice free workbook. I scroll through this, it's called Dreading to Quit, and it's just a very organized, aesthetic, and informative workbook that you can download and then work through, or even print out actually if you prefer paper. So just go to lunghealth.ca/tobacco in order to just check it out. And you can also call their phone number, 188-888, there we go, 344-LUNG or 5864, in order to talk to a certified respiratory educator who can actually provide a lot of great smoking cessation counseling and get other tips for quitting smoking as well, because you never know what might work out for you. All right, I think that's about it for today's webinar. So thank you for joining us today. I hope you learned a little bit about nicotine replacement therapy, as well as debunk some myths, and just talking a bit about what supports are available for you out there. One of the main messages is, of course, that you're not alone in your journey and that, you know, there are a lot of supports around you. So please feel free to reach out if you have any questions. You can reach us at our email, drkernu232@gmail.com, or the telephone for our main office, 905-667-0783. All right, that's about it for today. Thank you, everyone. Take care.